I'm on scene. I can't hear, see or smell anything that will indicate any dangers. Hi, my name's Aaron. Can you please tell me your name?
My name's Crystal.
Hi, Crystal. What seems to be the problem today?
Oh, I've got this really bad chest pain.
Chest pain. Okay, so the patient is responsive, and because she is talking, her airways are clear and her breathing is normal. Crystal, I'm just going to check for a radial pulse, okay? Okay, so the patient's perfusion is fine. Okay, Crystal, the patient's eyes open spontaneously. She can converse normally, and the patient also obeys any commands given. That indicates a GCS of 15. Now, Crystal, I'm just going to get my second officer to check for some vital signs.
Yeah.
Okay, while he's doing that, I'm just going to continue to ask you a few questions, okay? Okay, so you said you've got some chest pain. Now, is there anything that you do that makes the pain better, or makes the pain go away a bit, or does anything you can do that makes the pain worse?
No, it's just always there. I've tried lying down, sitting up, moving. It's just always there.
Okay. Now, what type of pain is it?
It's really, it's like it's heavy. I feel like somebody's got me in a big bear hug and squeezing me really tight across my chest.
Okay. Now, is that pain anywhere else, or is it just in your chest?
That pain's just in my chest. I'm a little bit sore in my jaw.
Yep.
But it's really bad in my chest.
Okay.
Really
Now,
bad.
how severe is it? So, if on a scale of 0 to 10, 0 is no pain at all, and 10 is the worst pain you've ever felt, how bad is that pain?
It's pretty up there. It's about an 8 out of 10.
An 8 out of 10.
Really bad.
Okay, now how long have you had this pain for?
Oh, not long before you got here, like 10 minutes. I called you straight away.
Okay, right. So about 15 minutes?
Yeah. Okay.
Now, during those 15 minutes, does the pain come and go, or is it constant?
No, it's been there constantly, just always there.
Okay. So the patient appears pale and diaphoretic. Now, is there anything else that's concerning you?
No, just the pain. I'm a little bit dizzy, just feel a bit dizzy, but it's mainly the pain. I can deal with the dizzy. It's just the pain.
Now, are you allergic to anything?
No, not at all.
Are you taking any medications at the moment?
Yeah, I take one for blood pressure, for Rama something, for blood pressure.
Okay, now is that for high blood pressure or is it for low blood pressure?
Yeah, high blood pressure.
High blood pressure?
Yeah, but it's normal now. I take it and it's normal.
Okay, so when was the last time that you took your medication?
This morning with breakfast.
This morning with breakfast, okay.
Yeah.
Have you felt pain like this before?
No, not like this. Not like this.
How have you felt over the past couple of days?
Yeah,
your health has been good?
Yeah, not a problem. Same as always.
Okay, now, do you have any other conditions? Do you have any diabetes, epilepsy, any asthma or thyroid conditions?
No, not at all. Just the blood pressure, but that's looked after. The doctor was looking after me.
Okay. Now, when was the last time that you ate or drank anything?
I had lunch today. Yeah, lunch
today? So maybe about 2 hours ago?
Yeah.
Okay.
That's it.
And what were you doing before you felt the pain? Were you doing anything?
I had lunch and then I had my cup of tea and I sat down to watch Bold and Beautiful and that was it. Okay, right.
Now my second officer has come back with your vital signs survey. That indicates a heart rate of 90 beats per minute. Okay. Your O2, your oxygen saturation, that's at 98% room air. Okay. The EGC indicates a sinus rhythm that has an ST segment abnormality. Okay. Now your blood pressure is moderately high. Okay, it's 150 over 85.
Okay.
So that's
moderate. That's a little bit high for me.
Moderate hypertension. Okay. Your temperature is 37 though, and your blood sugar levels are 5.7. Now they're both within normal. Okay. Now what I'm going to do now is I'm just going to do a few more assessments. Okay. I'm going to start with neurological assessment.
Okay.
As previously said, the patient's GCS is 15. Now I'm just going to check your pupils. Okay. Okay, so your pupils are both responsive to light and they're equal, okay, which is normal. Now can you please squeeze my hand? Excellent, so your motor abilities are normal as well. Can you please tell me what I'm doing?
Tickling my leg.
Okay, so your sensory is normal as well, okay. Now I'm going to check your respiratory state, okay. The patient is conscious. She appears pale and diaphoretic. The pulse rate is 90 beats per minute. Okay. Her breathing from view, her effort rate and rhythm are all normal. The patient's speech is clear and continuous. The skin colour of the patient is pale and appears diaphoretic. Now, what I'm going to do is I'm going to use my stethoscope and I'm going to listen to you breathe, okay?
Okay.
So just take a deep breath in and breathe out. And again. Just under here. And again. This side and again. Okay, now I'm going to have a listen to your back. Okay, breathe in and out. And again. And again. And again. Keep breathing. And one more time. Okay. Your breathing appears to be normal. Okay. Normally I would listen under the shirt, but for the purpose of this exercise it's above the shirt. Okay. Now if I could take your hand, I'm just going to check your perfusion. Okay, so your capillary refills under 2 seconds, which is normal. Okay, you appear pale and diaphoretic. Your radial pulse is at 90 beats per minute. Blood pressure, as I said before, it's 150/85. Okay, so that's moderately hypertensive. Okay, so it's a bit high. Okay, your skin colour is pale. So, as of this assessment, I suspect this to be chest pain associated with myocardial ischemia. The patient will be transported to the nearest appropriate hospital, and I will radio across for ICP backup so that they can meet me en route. Okay. During the care for the patient, an ACP or an ICP would complete a 12-lead ECG assessment. In addition, they would consider treating with aspirin, GTN, morphine, and possibly commence pre-hospital thrombolysis. At the hospital, the patient would undergo a further 12-lead analysis. They will check for troponin levels. Further blood analysis will be done. There will possibly be a consult with a cardiologist and possible transport to a cath lab if that's what's required. Okay, they'll also treat the patient according to their protocols for their presenting condition. Excellent. Put on this one.